This study that we've been involved in northern Kenya is simultaneously first resilience impact evaluation study that we did, and now is really sort of the most recent one because now it is also serving as a baseline for the next phase of what we call PREG 2. And so I will be giving you some summary findings from the ENDLINE survey, and then talk in more detail about the findings from the baseline, because there's been over the course of working on developing this impact evaluation, we've made a number of adjustments and improvements. And just as a bit of background, so the PREG Initiative is an initiative within USAID Kenya that tries to coordinate the activities of a number of different partners and projects working in northern Kenya around where their activities are cover different aspects of trying to enhance resilience of pastoralist communities. The PREG Initiative works very closely with the government of Kenya, works with the National Disaster Management Agency, and also in the context of Kenya, the process of devolution works very closely with the county governments. The PREG Initiative covers a very wide, large area, 9 counties in the north of Kenya, and as it says, focusing on these what have traditionally been pastoralist areas. Now, so what I want to give you first of all some of the findings from the ENDLINE survey, and again, as Tiffany pointed out this morning, this PREG study that was started in 2013 was our first resilience, our first attempt at a resilience impact evaluation, and our understanding of sort of all of the various dimensions of resilience measurement were still evolving at that time. And so on the one hand, we had not really what we've now come to think of as our full set of information about resilience, necessary information to look at resilience. And there was another critical issue that this was this baseline survey was combined with a Feed the Future zone of influence population-based survey, which imposed a lot of constraints in terms of the sampling design. I won't go into the details of all of those issues now, but we can, if you're interested, we can discuss more afterwards. But the upshot of all of this was that the information, we really were not in a position to have this be an effective impact evaluation study where we were comparing different control and treatment groups. So really what we have, the information that we have available to us for the ENDLINE is really looking at trends in the variables that we measured from the baseline to the ENDLINE round of the survey. But there's a number of quite interesting findings that did come out from this ENDLINE survey, comparing to the baseline. We saw quite significant improvements in a number of outcome indicators that we measured. We saw large increases, very large increases in per capita income and a reduction in poverty rate. We saw improvements in the stunting and wasting of children. One of the pieces of information that we did collect, starting from the baseline, was this information about households' perceived resilience, measured as their ability to, their perceived ability to cope with shocks in the future. And this, this indicator increased, and it particularly increased in one of the possible responses to that question was, were you able to increase, or sorry, were you able to cope, do you expect you'll be able to cope with shocks with some adjustments, which we understand to be using some kinds of resilience capacities that they have available to them. And then we also had the resilience, the dimensions of resilience capacities that we measured in the survey. We saw an increase in the percent of households that reported that they had increased savings. They increased this is the next point here is the dimension of social capital, ability to rely on others, and particularly we saw an increase in people's relying on non-relatives and people outside of their communities and their ethnic groups. And finally, a large shift in people's aspirations or really their perception about their ability to control their own future. And so this is just some graphics showing these changes that we saw from baseline to ENDLINE. Big decrease in the percentage of households below the poverty line of, in this case, $1.25 per person per day. An increase in per capita expenditures, which is our proxy for income. So big changes. Again, as I mentioned, increase in households that reported that they felt like they were able to cope with shocks that they would face in the future. A big increase in the households that reported that they had increased savings, so from tenfold increase from 2% to almost 22%. And then this big increase in households that reported that they felt that they had responsibility in being able to achieve their future success. So we see results from these findings that there were big improvements in the face of repeated large-scale shocks, droughts in particular, over the course of this time frame. Okay. Oh yeah, sorry. Okay. So that's a quick overview of some of the main findings that came out from the ENDLINE. So now what I want to turn to is talk in more detail about the baseline survey, because now for this baseline survey, two things changed. One is that we now, the questions that we ask for the baseline is the full set of questions that get information about all the elements of measuring resilience capacities of the households, their exposure to shocks, the kinds of coping strategies that they adopt.
We want you here because we want the video.
So you're on TV.
So you don't move. Sorry.
So one thing was we had a much more complete set of information about resilience capacities, and then the other thing was that we were able to resolve the sampling issues, so that we were able to identify areas of high programming intensity and low in programming intensity, so we'd have a really effective comparison, treatment, and control groups moving forward. So just to summarize some of the main takeaways from the baseline survey, we found as the main reported shocks, rising food prices actually came out even higher than drought, and flooding also came out higher. We'll see why that happened later on. But it was basically rising food prices, flooding, drought, and livestock disease were the most widely reported shocks. In terms of coping strategy, similar to what we saw this morning with the prime, reducing food consumption was the most common sort of outcome or coping strategy response to shocks. And the other thing that now really comes really to more looking at the resilience analysis is that we see that in fact these resilience capacities and a number of the components are strongly associated with better well-being outcomes and recovery from drought. And the specific resilience capacity components that come out to be the most significant at the household level are the usual things that we saw, that Tim pointed out in our general list of components that across, when we look across these studies, it's sort of the same thing. It's assets and savings, participation in shock preparedness, training and support, remittances, social capital, education, aspirations, and at the community level, infrastructure and markets. So these are what come out to be the most important components that explain improvements in outcomes. This slide you'll recognize from the prime presentation. So the analysis that we've undertaken in this study is the same as what was done in the prime. We are looking at measuring these three resilience capacities, the absorptive, adaptive, and transformative capacity, by measuring all of the components that go into those capacities. So this is a map of the counties in northern Kenya where the PREG operates. And the map shows that there are several counties that are what we call low-intensity counties, where the main intervention, or really the only resilience-related intervention in those counties, is providing humanitarian assistance. And then the red counties are where more development-oriented resilience investments are being made. And so in this round of the impact evaluation, we're taking advantage of comparing these high and low intensity counties. And again, you'll recognize this slide from this morning, but within each of these three capacities, we're looking at a long list, and actually the same list, of specific components that go into each one of these capacities. And specifically for this baseline study, we did research to address two main questions. The first is about looking at the relationship between resilience capacities as they've been aggregated up. We have an index that the aggregate resilience capacities, the three, but then also looking at each one of the components that goes into those capacities, how they're related to the achievement of households' outcomes in terms of income, in terms of food security, in terms of ability of actual recovery from the shocks, how those are related to the resilience capacities and their components. And then the other question that we look at is, how do households, what coping strategies do households use to deal with shock, and how are those coping strategies related to the kinds of capacities that households have. So these are the main questions that we're looking at. This PREG 2 resilience analysis it's an impact evaluation. We are looking at it's a quasi-experimental design where we're comparing in this, we have a treatment and control group. In this case, it's sort of the low intensity, which is only areas that are only receiving humanitarian assistance, compared those with areas that receive humanitarian assistance plus other kinds of interventions. We have a number of different analytical techniques that we will be using to conduct the analysis. It will be similar to what we've done with the PRIME analysis. This will be a panel design. So the plan is that in the later survey rounds, we will go back to the same households to collect information. So we'll be able to actually compare changes of individual households and changes in their resilience capacities over time. So a little bit more detail on these intensity categories. As a first step, we've identified the low intensity and high intensity groups, as I've already talked about. But then the high intensity, we actually then sort of sub-stratified to look at different levels of, let's say, development type investments. And so we have the Regal/LMS, the Regal projects, and then now the LMS. These are sort of the main resilience projects in northern Kenya. But then there are a number of other projects under the PREG umbrella that also are undertaking resilience investments. So we've looked at sort of different levels of support that have been provided through the Regal LMS projects with some other combinations of other development investments. And so the idea is that we have, our high intensity was actually capturing a range of variation in terms of development, intensity of development investments. And so this will allow us to look more closely at this layering of different project activities and what is the impact of layering on resilience capacities and outcomes. So this survey, the baseline for PREG 2, was conducted in August and September of last year. So this was during the lean season. And this, the total sample was about 2,800 households split between the high and low intensity groups. Again, this was a mixed method study, so we had both a quantitative and a qualitative component. We conducted 32 focus group discussions and then 50 key informant interviews across the survey area. And then, in our analysis, we have incorporated both the qualitative and quantitative information to give a fuller understanding of what's the situation on the ground. Looking first at livelihoods, information that was collected about livelihoods. In the qualitative information about livelihoods revealed what's sort of known about what's happening in the pastoralist areas of northern Kenya is that there's been a number of trends that have put pressures on the traditional livestock-based livelihoods. So we're talking here about climate changes, changes in weather patterns that have affected productivity, also population growth, also urbanization, sort of economic development that has created different pressures and also provided different opportunities in terms of livelihoods. And in the qualitative interviews highlighted this process of different options that households can undertake or do undertake in response to these changing underlying conditions. And one is what's called the stepping up, which was some households, if they have the means and ability, they intensify their agricultural or livestock production by making investments in those activities, expanding the scale of those activities. Another different strategy is to diversify so that they stay in agriculture and livestock, but they engage in other kinds of activities to diversify their sources of income. And then the third option is moving out, basically exiting agriculture and livestock, moving to urban areas and engaging in other kinds of livelihoods. So this is, the qualitative information supported or found that these are in fact different strategies that people and households follow. In terms of looking at the kinds of shocks that the households experienced this is from the quantitative information. The most common shock that people reported was actually rising food prices. And the next most frequent was flooding, and drought was actually the third most frequent cited, and then livestock disease, which is, considering that this was during a time of drought, it's interesting to see that this pattern, and we'll see why particularly flooding also showed up. So this graph shows information about the pattern of precipitation over the year before the survey. And so what you can see here is that in the months prior to the survey was actually a period of above average rainfall. And there was a time of flooding actually. So that, it's not surprising that we saw flooding was a high, there's a high percentage of households reporting flooding as a shock. Coping strategies. What were the most frequent kinds of coping strategies that households reported they adopted? Similar to the case of crime, the most common reported coping strategy was reducing food consumption. And then followed that with selling livestock, getting food on credit, and reducing household expenditures. In terms of the well-being outcomes, the bottom part of the chart here shows the well-being outcome indicators that we have measured in this survey. The household dietary diversity score, which ranges from 0 to 12 items that the household consumed in the day prior to the interview. And the average for the low intensity group is, you know, a little over 5, and the high-intensity group is closer to 6. The FIES, the Food Insecurity Experiential Score, is a experiential indicator that based on a series of questions that identifies households' perceived level of food insecurity. We have daily expenditures, per capita expenditures in dollars. We have the first number here is the mean value, and the second number is the median value. And then the last, the poverty, percentage of households below the poverty rate. And one of the important things to see in this, in these numbers is there's not much difference between the high and low intensity categories in terms of all of these outcome measures. And from a impact evaluation perspective, that's a good thing, right? Because this is our baseline, and this tells us at the baseline, that is before there's going to be the next round of interventions, resilience interventions, there's not much difference between these populations. The other thing to note is that quite a high percentage of households reported that they felt like they fell into the category of moderate to food insecure. But at the same time, per capita expenditure is, not super low when compared to the poverty low. And about a third of the population fell below that poverty level. So that's sort of a picture of where the sample was in terms of these well-being outcomes. We also have information about households' recovery from the shocks that they experienced. And again, we were looking at how we were looking at here at the main types of shocks that households reported: floods, drought, livestock disease, and increased food prices. And these graphs show the percentage of households that reported that they have recovered from these shocks. Generally, the numbers are pretty low. For many of the shocks, there's not much difference between the two groups. The livestock, the recovery from livestock disease is actually lower in the high-intensity group, whereas the recovery from increased food prices is higher in the high-intensity group. One of the things that might explain this difference on the livestock disease is that it turns out that the low-intensity areas are more agricultural than the high-intensity areas. So livestock disease is, maybe more prevalent in the high-intensity areas. In terms of looking at child nutrition outcomes, these are the numbers of children that are stunted, wasted, and underweight. And again, not much difference between, no statistical difference between the low intensity and the high intensity groups. So now turning from looking at these outcomes, now looking at the resilience capacities. What we have here are these are the indices that were computed based on all of the different components that go into each of these three capacities. An index was computed using factor analysis, and you can see that generally, so these are on a scale, these indices are on a scale of 0 to 100. Generally, the levels of these indices is quite low. And again, not much difference between our high intensity and low intensity groups. This information is also consistent with what we heard from the interviews of the qualitative study, that the households' perception that their resilience capacities or their ability to cope with future shocks was quite low. So, getting now into the analysis of looking at the relationship between the resilience capacities, these three capacities, absorptive, adaptive, and transformative capacities, and how they are related to households' well-being outcomes. This graph shows that each of the three capacities are significantly related to households' ability, households' improved well-being and their ability to recover from shocks. And this information comes from regression analyses that were done. And these regression analyses looked at households, these well-being outcomes as a function of the household's resilience capacities, but also their level of shock exposure, right? So the way you interpret these numbers is that for a given level of shock exposure, households that have higher levels of each one of these capacities have a lower levels of poverty, higher levels of diversity score, are less likely to report that they are moderately or severely food insecure, more likely to recover from drought. So basically what we're seeing here is that each of these capacities, and particularly the absorptive and adaptive capacities, are strongly related to improvements in these outcomes in the face of shocks. Now, when we look at the individual components that go into each one of these resilience capacities, this shows which individual components are associated with better outcomes and sort of the magnitude of how they affect. In this case, we're looking at poverty, the likelihood that the household will be poor. And so these are, in terms of the absorptive capacity, these are the three components that came out most significant: assets. And so the way we interpret this bar, for example, is to say that households, what we're saying is if households that move from the lowest quartile in our sample in terms of their assets to the highest quartile, so it's a big change that we're looking at in terms of the assets, that leads to a reduction of 48% in the likelihood that the household will be poor. So we can see that there's big changes associated with a number of these components in terms of reducing poverty, or the likelihood that the household will be poor. And then this is a similar graph showing the components of the three capacities that are associated with reduction in the likelihood that the household will experience food insecurity. And again, you can see it's a lot of the same components show up: savings, assets, education, training, social capital, access to infrastructure. These are the components that keep showing up in these analyses. This is a similar graph showing the recovery from drought. And what are the specific resilience capacities that increase the likelihood that the household will recover from drought. And not surprisingly, shock preparedness training, participation in shock preparedness training is an important component. Access to humanitarian assistance, and then again, assets. In terms of adaptive capacity, social network index, aspirations, and gender neutral practices, which is a sort of a social norm component of the transformative capacity. So these are all things that are associated with households being able to recover from drought. We also looked at recovery from some of the other major shocks, flooding, rising food prices, livestock prices, and then you can see these are the resilience components that are associated with households being able to recover from those shocks. So you see that there's a lot of these components show up in terms of improvements in all of these outcomes. You know, assets, savings, social networks, shock and preparation mitigation, they're all quite common factors that explain improvements. So the other kind of analysis that we did was to look at the relationship between resilience capacities and, in this case, project engagement. So remember that this is not a baseline in the sense that we're going in and doing a survey before there's been any kind of intervention. Even at this baseline survey, households have been participating in different kinds of project activities, in trainings, or participating in community groups. And so in our survey, we collected information about this participation. And then what we're doing here is looking at the relationship between participating in either training or in project supporting groups. What's the difference between those two groups in terms of their absorptive capacity and their adaptive capacity? And what we see here is that the households that have participated in either trainings or groups have higher levels of absorptive and adaptive capacity. Now, we should really only be interpreting this as indicative at this point, right? This is just, we're looking at one point in time. This could reflect sort of selection bias that households that participate in these groups or this trainings may be different just because for some reason those that decided to participate are different. But it's an indicative or suggestive, I guess I should say, that there is some relation to looking at that the training and the community groups are associated with higher levels of these capacities. When we have later rounds of information, we'll be able to look at that more carefully. So, to summarize sort of what all of these findings mean in terms of programming implications, again, as we went through those findings, these particular areas, components of resilience capacities, are the things that have come out to be the most strongly associated with improved outcomes and improved recovery. Education training, assets and savings, aspirations, social capital and networking, participation in shock preparedness, infrastructure and markets. So these are areas that seem to have the strongest association with households being able to improve to be able to recover from shocks or to have higher levels of outcomes in the face of shocks. So in terms of what's planned for future research and some areas for future research that have come out of these baseline findings, one of the things is that as a result of our change or our refining of both the questionnaires, the kinds of information that we collect, and also our refining of the sampling, we are in a position to be able to really conduct an impact evaluation. We're going to be able to effectively compare high and low intensity groups and see what's the difference between those groups and make some statements about the extent to which programming has led to those differences. One of the things that we plan to do is similar to what Tim talked about this morning in the prime analysis. We want to expand our analysis to look at exposure. So we talked about the difference between exposure and participation. We want to capture that distinction in the analysis in Kenya, and that will involve collecting information really from projects to be able to say more clearly where it is that their systems level interventions are actually exposing different populations to the benefits of those interventions. Another thing that we will be doing in this PREG study is we are actually starting right now on what we call recurrent monitoring surveys. And I don't think we've talked about these very much today, but basically the purpose of these recurrent monitoring surveys is they're shock-triggered surveys. So what that means is when a large widespread shock affects a large population in our study area, we set up these recurrent monitoring systems to collect information from a smaller number of households normally, but over time, repeatedly over time. So it's a panel design again. We go to the same households, and we go on short intervals. We go on 2-month intervals. There will be, actually in Kenya, I think it will be 3-month intervals, or 2 or 3-month intervals. And we collect information, more detailed information about how the households are responding to the shock. And in this case, it's a serious drought that has triggered the RMS in northern Kenya. So the RMSs will be collecting information over time about how the households are what they're doing to recover from the shock and how effectively they're able to recover. And then we can look at the different characteristics of different households and see how that affects their ability to recover. Another research area for research that has come out of this baseline study was to look at livelihood diversification, because we have somewhat conflicting information from our quantitative findings with our qualitative findings about livelihood diversification. And basically the differences are, number one, are households diversifying more or less? The qualitative findings talked about how households are diversifying, but our quantitative information actually shows slight decrease in diversification, although movement out of livestock. But then the other question that we need to do some more research to understand better is this diversification a positive strategy that households are following as a way to diversify their exposure to risks, or let's say reduce their exposure to different kinds of risks? Or is it a coping strategy? Are people being pushed into low return kinds of livelihoods, like maybe collecting, selling charcoal, as a way that they're being pushed into as a way to earn money when times are bad? So that's a question that has come out of this baseline study that warrants further research. Okay, so that's a quick summary of both the ENDLINE, the results from the PREG 1 ENDLINE survey, and the findings from the PREG 2 baseline survey.
Okay.